Moral realism in healthcare ethics. When healthcare professionals make ethical judgments, they often speak as if some actions are genuinely right and others genuinely wrong. Moral realism is the ethical position that takes this way of speaking seriously. Moral realism is a meta ethical theory that asserts the existence of objective moral facts and values that are independent of individual beliefs, personal feelings, or cultural norms. According to moral realism, moral statements are not merely expressions of opinion or social convention. They can be true or false, in much the same way that factual claims can be true or false. In healthcare ethics, moral realism provides a philosophical foundation for the idea that ethical standards are not invented by institutions, negotiated by consensus, or reduced to preference. Instead, ethical principles such as respect for persons, avoidance of harm, and fairness correspond to real moral features of the world. This perspective has deep historical roots in moral philosophy and is often associated with thinkers such as G.E. Moore, who argued that moral properties like goodness are real and irreducible. While healthcare professionals do not need to engage with this philosophy explicitly, moral realism underlies much of how ethical reasoning is actually practiced in medicine and healthcare. When clinicians say that it is wrong to deceive patients, wrong to exploit vulnerability, or wrong to discriminate in care, they are usually making realist moral claims. They are not merely stating personal preferences or cultural habits. They are asserting that these actions are wrong regardless of who approves of them. In healthcare ethics, moral realism supports the idea that ethical principles have authority beyond individual opinion. The principles of autonomy, beneficence, non maleficence, and justice are treated as morally binding not because they are popular or legally enforced, but because they correspond to objective moral obligations. This is especially important in healthcare because clinical decisions often involve power asymmetries. Patients are vulnerable, dependent, and exposed. Moral realism provides a basis for saying that certain actions toward patients are wrong, even if they are efficient, profitable, or socially accepted. Moral realism also explains why ethical critique in healthcare is meaningful. If moral values were purely subjective or culturally relative, it would be difficult to criticize unethical practices beyond saying that one personally disapproves of them. Moral realism allows healthcare professionals to say that practices such as neglect, abuse, coercion, or unjust resource allocation are morally wrong, even if they occur within accepted systems. In your healthcare ethics framework, moral realism functions at the meta ethical level. It does not tell clinicians exactly what to do in every situation, but it explains why ethical reasoning matters at all. It underwrites the assumption that ethical deliberation is about discovering what ought to be done, not merely negotiating preferences. This perspective is crucial in areas such as human rights, patient dignity, and professional responsibility. The idea that patients possess inherent moral worth does not depend on cultural agreement or institutional policy. It reflects an objective moral fact about persons. Moral realism also supports the possibility of moral progress in healthcare. Practices once considered acceptable, such as discrimination, non consensual experimentation, or denial of care, can be judged as objectively wrong, even if they were widely endorsed at the time. Ethical improvement is possible because moral truth is not fixed by belief. At the same time, moral realism does not deny moral disagreement. Healthcare professionals often disagree about what the moral facts require in complex cases. Moral realism simply holds that disagreement does not eliminate truth. Ethical reasoning is therefore a process of inquiry, reflection, and justification aimed at getting closer to moral reality. Critics of moral realism argue that objective moral facts are difficult to explain or verify. However, in healthcare practice, professionals routinely act as moral realists without naming the theory. Codes of ethics, patient rights, and professional obligations all presuppose that some actions are truly unethical, not merely unpopular. In applied healthcare ethics, moral realism provides stability. It resists the idea that ethics shifts entirely with social trends or institutional pressure. It anchors ethical decision making in the belief that moral truth places real limits on what healthcare professionals may rightly do. In your healthcare ethics text, moral realism helps explain why ethical principles are treated as more than procedural tools. They are responses to real moral demands arising from human vulnerability, dignity, and the responsibilities of care. Understanding moral realism is essential because it clarifies why ethical claims in healthcare carry weight, why moral disagreement matters, and why ethical reasoning is not optional. It affirms that healthcare ethics is not merely about opinion, policy, or preference, but about truth.